Good afternoon, class. With 3 subjects, basic science, class for JS2 class. Our topic for today is reproductive health. Then, our objective for today: the student should be able to explain health. The student should be able to explain reproductive health. The student should be able to list importance of reproductive health, and the student should be able to explain how to care for reproductive organs. When we say health is defined as the condition of a person's body or mind. Health is the state of being physically and mentally healthy. When we say health, is a person's state of mind, person's body or mind, and is also a state of being physically. When they are saying you are healthy, and mentally you are healthy. You are good looking. Your face is smiling. Your skin is smooth, not squeezed. That is when they say somebody is in good state of mind. And health is also the work of providing medical services for health workers. That's it. You have to provide medical services for health workers. From there, we move to reproduction. Reproduction is connected with reproducing babies. When we are reproducing babies, when our mothers are pregnant and they give birth to us, that is what we mean by what? Reproduction. Then reproductive health. This reproductive health refers to the various health processes that people undergo from puberty. They undergo it from puberty and during pregnancy and after delivery to ensure that their reproductive organs are in good health and in good condition. This process includes, when we say reproductive health, that is, we must make sure all our reproductive health or organs are in good condition, especially when we are in puberty stage. As a girl of puberty stage, there are things that happen during this stage. For a girl at puberty stage, from 8 years upward, you should be expecting some physical changes in you. And some changes that is going to happen to a girl during this stage. There we have menstruation. It is compulsory for every woman of childbearing. For every girl, it is compulsory for you to menstruate. When you are menstruating, you should be able to take good care of yourself. As a pregnant woman, you should be able to take good care of yourself and go to the hospital where they are going to take good care of you, to check on your baby, to check on your organs, and after delivery, to make sure everything goes back to normal. And this process includes medical checkup. You have to be checking yourself often and often. As a pregnant woman, You have to go for antenatal checkup in the hospital. Once you are pregnant, you have to register in any hospital of your choice so that they will be in charge of you. They will take care of you and your baby and make sure your organs go back to normal after delivery. 3. We also have healthy practices such as eating balanced diet, keeping body and genital clean often and often, checking your breast and testicles for long. You have to check your breast. When you wake up in the morning, you lie down flat on the bed. You use your right hand to check your left side breast. As you are lying down, you check it round. If you find any lumps there, you raise alarm by telling your parents what you are experiencing, what you experience. Another one, maintaining proper hygiene during menstruation. You have to maintain proper hygiene during menstruation. You have to take good care of yourself during menstruation so that you will not have bad odor during this period. Getting abnormal discharge. Getting abnormal genital discharge checked. That's another health practice. Then from there we move to genetic counseling. Genetic counseling. This is the counseling given in the hospital to a pregnant woman to informate her about sex determination of the baby and the effect of genetics on the baby eye, hair, skin, colors, and eyes. This is the reason for us to go to hospital during pregnancy, because as a woman, even before pregnancy, you have to go to seek for counseling. There, that's when they will tell you your blood group, your genotype. This is the genotype you have to get married to. This is the genotype you don't have to get married to. This is the blood group you have to get married to. This is the blood group you don't have to get married to. This is when they are going to give you genetic counseling about your health. Another one, we have myth of breastfeeding. A woman who is breastfeeding a baby cannot be pregnant, which is not always true. Although they said some women during when they are breastfeeding baby, they can't be pregnant. But at times it is not true, because some women, when they are breastfeeding, they still have their normal period, which is their menstruation. While some, they don't do menstruation. But the ones that are doing, it is possible for them to become pregnant. And that is why it is not advisable to have sex when you are breastfeeding, so that the baby will not suck sperm in the breast. This is a false absorption, because it is not possible. The baby is not sucking sperm. Another thing we are going to discuss is the advantages of breastfeeding. What is the advantage of breastfeeding? It is cheap and readily available. It is available for the baby to take, and it is very cheap. It's not something you can buy or you don't have money to buy it. Once you are pregnant, the breast milk is stationed there. Once baby is out, baby should start sucking breast. It is very cheap. You are not buying it with any money. No risk of contamination because it is natural. And cholesterol. Milk secreted in the first few days after delivery is rich in protein, and it is believed to give the baby temporary immunity to infectious diseases. So the first breast milk that is coming out of the breast, it is very, very rich in protein to attack, to prevent the baby from some infections. Another one, if a woman breastfeeds very well, it will help the womb to go back to normal soon after delivery. If a woman breastfeeds very well, it's going to help the womb to go back to normal position. That means the woman is not going to have big tummy when you breastfeed very, very well. Then another one, we have mode of transmission of HIV. How can HIV be transmitted? From unprotected sex. If you are having sex without protecting yourself, you can contact HIV. The best way for us not to contact it is to what? Abstain from sex. 2. Blood transfusion and sharing a sharp object. Don't share sharp objects, either blade and scissors, needle. You don't share it to people. Try to get your things available whenever you need them. 3. From mother to child. That is when we can transmit this HIV. This is where we can contact it. Prevention of HIV. How can we prevent ourselves from HIV? Number 1, abstinence from sex. You have to abstain yourself from sex. Not sharing drug injection equipment. Not sharing any sharp object or drug injection equipment. That's the syringe they use to inject people in the hospital. You don't share it with people. You don't play with it. You don't toy with it. 3. Screening blood before transfusion. You have to screen the blood properly before you are going to give it to any patient in the hospital. Use of condom where it is needed. Be faithful to an uninfected partner. Then the last one, HIV is found in the blood, vaginal secretion, and in the breast milk. So these are where we can prevent HIV/AIDS. Then our evaluation for today. Our evaluation. What is health? Then explain reproductive health. We are going to explain reproductive health. What is genetic counseling? 3. What are the advantages of breastfeeding? Then 4. Mode of transmission of HIV. And 5. How can we prevent HIV? So our assignment for today is, what is abstinence? 2.